Really excited to be here today. What a fantastic week. What a fantastic event. Congratulations to the entire HealthTO team. A big thank you to our team, who's on the right-hand side right over there. Come say hi to us afterwards. And for all of you for being here today, because the critical piece for advancing healthcare in Canada is actually patient advocacy. And I'll get into that in a little bit. So this is a very personal start to the story. I got into healthcare space because I got sick. After Groupon had acquired our startup a number of years ago, I moved to Chicago with the rest of our family team and my young family. And after just a couple of months, I was diagnosed with Crohn's disease on a visit back to Toronto. So I suddenly had to uproot again and come back home, and unexpectedly was in the hospital for a month as they kind of put me back together. And then I was an outpatient for another 6 months. And I couldn't believe the fact that I had to travel 40 minutes each way to get to an appointment, whether it was iron infusions, blood work, seeing a stress counselor, my GI, my GP, etc. It was literally like a full-time job. And I started to research the OHIP codes and the other provincial programs and realized that home-based care for physicians in Ontario is actually covered under OHIP. And started to decide, okay, well, this is something that impacts me and impacts me as a father because I have 2 little ones. And when my older little one turned 2, she started nursery. And seemingly every week, she either brought home an illness or an art project. I'm sure other people feel the same way. And we started to rely on the system a lot more actively. So between myself being a patient with a chronic illness and now a dad with 2 little ones, we love our pediatrician, but let's be real, she's only available 35 hours a week. And we end up calling telehealth, which we can talk about in another conversation, as well as ending up at a fantastic world-class hospital like Sick Kids. So after yet another late night with my little ones, I said, you know what, enough's enough. We have to give this a shot. And I felt, okay, well, if this problem resonates with my entire family, let's see what the situation is with other patients and their families. And so we set out, before we wrote a line of code, before we raised $1, we interviewed over 1,000 Ontario patients, or Canadian patients rather, and we found that there was a severe lack of access to care, which is an existing problem that they see in the UK and the US as well, where the system is sorely overburdened. There simply aren't enough clinic appointments, let alone hospital capacity to take care of everyone today, let alone 5 years once everyone is seemingly a baby boomer, gets far more older, 65 plus. So we found that 87% of people wanted better access to care, 75% of people could not get an appointment and ended up at Emerge, and that home-based care was a solution. We then set out, okay, we qualified it with patients, now let's learn about the system. I actually think being in a universal healthcare system is a really big benefit for a health technology company, because if you persist and you gain adoption, you're accepted everywhere, as opposed to fighting the battles in the US. So we found that a lot of doctors, for example, were already offering home-based care. It was ad hoc, it was through their secretary, it was entirely disintermediated, but we were able to work with a government relations firm and a consulting firm in the research space to learn as much as we could to qualify the program, the platform rather, from the payer side as well as the provider side. And then we looked at other verticals. We said, okay, well, let's look at Uberizing healthcare. And we looked at, obviously, the opportunities that an Uber model would present, but it dehumanizes it, it depersonalizes it. You want continuity of care for yourself and your loved ones, which an Uber model does not provide. Certainly you get the convenience, but what about continuity of the health record, continuity of care? It's not there. So then we looked at OpenTable, which is arguably my favorite app, because every time we get a sitter, we go right on OpenTable and book a reservation, and you get the choice, you get the control, and so we modeled it after that. So with MediSeen, you're able to actually browse healthcare providers who are using our platform to build their very own healthcare practice outside or complement to their clinic or hospital-based work. They set their hours, they set their rates, they set their radius of travel, and they are now able to operate independently and decouple from a clinic successfully. As a patient, you then get to browse the care providers that are available to you based on things such as their education, their academic experience. You can browse based on rates, etc., and ultimately pick one. Ryan's a fantastic healthcare partner of ours. And ultimately, we realized it's all about monogamy. People don't want 17 different RMTs. They don't want 4 different chiropractors. They want 1 chiropractor. They want 1 RMT. They want 1 doctor ideally. And certainly if they're not available, there are going to be alternatives to complement their newfound circle of care. So it's all about supporting the provider-patient relationship and supporting a commitment, a long-term commitment between those patients and providers and continuity of care. So other considerations I'll skip. And ultimately, timing's everything. So we're really excited about seeing support from the Ministry of Health, from Health Canada, to be able to take care of the people we care most about, especially with the aging population. So we're really excited to be in this space. We wouldn't be here without our partners right across the spectrum, accelerators like Venture Lab and Obio, programs like Weave, our media partner BetaKit back there. And come say hello. We're right outside. We're really happy to be here, and thank you all for coming out today.
Yeah, well done.